Okay, let's start with something really quite striking. Did you know that transgender women in the United States are 49 times more likely to be living with HIV compared to the general population?
49 times.
Yeah, it's a statistic that truly stops you in your tracks.
It really does.
So today, we're going to try and unpack that. We're diving into why this marginalized community faces such amplified vulnerability. We've got some crucial sources here, and we'll be exploring this complex issue of disproportionately high HIV rates among transgender individuals.
And it's so important we do. This isn't just a number, as you said. It's a pressing public health crisis,
Yeah.
often overlooked, sadly.
hmm
Our mission today really is to pull out the key insights from the research, from the reports, to give you, our listeners, a clearer understanding. Because understanding these unique challenges is just crucial if we want to move towards equitable healthcare.
And a more inclusive society, ultimately.
Exactly. We need to look at the mechanisms, what's actually happening, and figure out where interventions can really make a difference.
Okay, so let's ground ourselves in those numbers again, because they really do paint a stark picture. That 49 times higher likelihood.
It's not just an average, right? It hits transgender women of color particularly hard.
Yeah, that's a critical point. The disparities run deep. There was a CDC report back in 2019. It wasn't just estimating, it gave specific prevalence rates.
Okay.
And they found that a staggering 44% of Black transgender women, 44%,
Wow.
and 26% of Hispanic transgender women in the U.S. are living with HIV.
26%.
Now, compare that to just 2% of the general adult population.
The contrast is huge.
It's dramatic. And it's not coincidence. These differences, these disparities, they're driven by a really complex, multifaceted set of challenges. It's not just one thing.
Right. So when you say complex web, what are the main threads? Are we talking about systemic barriers, things that kind of create a vicious cycle?
Absolutely. That's a good way to put it. We're looking at pervasive systemic barriers that interlock. Things like profound social stigma.
Severely limited access to healthcare and persistent economic instability. These aren't separate issues. They combine, they interact, and they create exactly what you said, a vicious cycle.
And this cycle, it does what? Increases risk and complicates things.
Precisely. It heightens HIV risk, and it dramatically complicates prevention efforts. Makes treatment adherence really difficult, too. It just makes it incredibly hard for people to break free.
Can you give us some concrete examples? What does that actually look like for someone day to day? How does it restrict access to care?
Sure. Let's take healthcare access. Many transgender individuals simply lack health insurance.
Right.
Or even if they have insurance, they often run into providers who just aren't trained in transgender-specific health needs.
Okay, so it's not just about cost.
No, not at all. It can lead to, being misgendered, having valid concerns dismissed, sometimes even outright refusal of care.
That must create so much distrust.
Yeah, exactly. It leads to what researchers call anticipated stigma. People start delaying or avoiding care because they expect negative treatment. Trust erodes before they even step into the clinic. Then you layer on top of that things like poverty, homelessness, unemployment. These are disproportionately high in trans communities.
Social determinants.
Right. And if you're fighting to find safe housing or figure out where your next meal is coming from,
Yeah.
accessing things like condoms or PGE, that's the medication, pre-exposure prophylaxis that prevents HIV, it just becomes a distant priority, almost impossible for some.
So basic survival takes precedence over prevention.
Understandably, yes. These economic realities directly shape health outcomes.
And what about discrimination outside the clinic? Rejection from family, employers, the community. I imagine that leads to isolation, mental health issues.
Yeah.
How does that feed into the HIV crisis?
That's a really important piece. Survival. These huge stressors, constant rejection, systemic discrimination, they can sometimes push individuals towards survival strategies that carry higher risks.
Like transactional sex.
Like transactional sex, yes. It's often not a choice made lightly, but one born out of, sheer necessity when other paths to stability are just blocked.
Right, yeah.
And then you have policies like the criminalization of sex work, plus discriminatory practices in healthcare itself.
Yeah.
It creates an environment where trans people are understandably less likely to seek testing or treatment.
Out of fear.
Out of fear of legal trouble or just more mistreatment. And that, unfortunately, helps perpetuate the spread of HIV because people who are undiagnosed can't get the care they need to stay healthy and prevent transmission.
We've touched on the big picture challenges.
Yeah.
But let's dig a bit deeper now, starting with stigma. How does transphobia specifically contribute, maybe beyond just direct refusal of care?
Well, stigma, it's not just about those individual moments of discrimination, though those are damaging. It sort of permeates everything. It creates this hostile environment that really undermines health in general.
Yeah.
Transphobia in healthcare settings is a huge barrier. It actively discourages people from seeking routine tests or treatment. Remember that 2015 U.S. Transgender survey?
Vaguely, yeah.
It found that a third, 33% of respondents who'd seen a healthcare provider had at least one negative experience, like being refused care outright or verbally harassed specifically because they were trans.
A third. That's significant.
It is, but it's also the subtler things, the everyday microaggressions, misgendering, dismissive language, just a lack of basic understanding that chips away at trust over time.
So it creates this psychological barrier you mentioned earlier.
Exactly. People start anticipating bad treatment, so they delay or avoid care altogether. And when that happens, proactive health stuff like regular HIV testing or sticking with pre-OEP becomes incredibly difficult.
That kind of repeated negative experience. How did that affect someone's behavior long term, their trust in the whole medical system?
It creates this really deep, ingrained distrust.
Mhm.
Think about it, if the system that's supposed to heal you actually inflicts more trauma through prejudice.
You'd naturally pull away.
Understandably, yes. People might only seek care in absolute emergencies or avoid it completely. Chronic conditions go unmanaged, preventative stuff gets missed,
Which leads directly to worse health outcomes.
including delayed HIV diagnoses, delayed treatment, and that, in turn, contributes to higher transmission rates within the community. It's all connected.
Okay, moving beyond the clinic interactions. Let's talk more about the economic side. Employment, housing discrimination. How do those factor directly into HIV vulnerability?
Oh, their impact is profound and very direct. Transgender people face unemployment rates twice as high as the general population.
Jesus, side.
And nearly 30% of those surveyed reported experiencing homelessness at some point.
30% homeless at some point. That's huge.
It is. And these severe economic insecurities, they don't just cause hardship. They often, as we touched on, force people into survival strategies that increase HIV risk.
Like transactional sex for basic needs.
Exactly, to secure food, shelter. And in those situations, negotiating safer sex can be really difficult because of power imbalances or fear. And here's another critical piece: violence. Transgender individuals, especially trans women of color, are disproportionately targeted by violence.
Physical and psychological?
Both. And that violence further limits their ability to negotiate safer sex. It can prevent them from accessing health care due to injury or trauma. It can even disrupt things like consistently taking pre-PP. It just adds more layers of vulnerability.
It really sounds like the system is actively working against them in so many ways. What about prevention efforts? Are they doing enough for this specific community, or is there a gap?
There's definitely a gap, a significant critical gap in targeted HIV prevention and education.
How so?
Well, most HIV campaigns, historically and even now sometimes, are designed with cisgender people in mind. They often just fail to address the unique needs, the unique experiences of transgender individuals.
Can you give an example?
Sure. Think about campaigns aimed at men who have sex with men, or MSM. These often exclude transgender women, even though many might identify with that behavior sexually. But then, they also often get excluded from campaigns aimed at women because of narrow definitions of gender.
So they fall through the cracks.
Completely. This huge gap in outreach means trans communities are often underserved, sometimes misinformed, or just not reached at all by info about resources like pre-OP or PP post-exposure prophylaxis.
Right, PP for after potential exposure.
Yeah. Without culturally competent, specifically tailored messaging, prevention just remains inadequate for them.
And how does the intersection of identities, race, gender identity, socioeconomic status, make this even more complicated? It's not just additive, is it?
No, absolutely not. And this brings up the crucial concept of intersectionality. It's essential for understanding the compounded vulnerabilities.
Yeah.
It's not just, adding one type of discrimination onto another. Think about a Black transgender woman.
Right.
She faces transphobia, yes, but she also encounters structural racism in healthcare, racial bias in employment, societal prejudice based on her gender expression.
There's multiple layers interacting.
Exactly. They multiply, they interact dynamically, they create unique, magnified barriers to stability, safety, care. Barriers that are distinct from those faced by, say, a white trans woman or a Black cisgender woman.
Is that specific combination?
Yes. This multi-layered disadvantage, this deep-seated structural racism within the systems meant to help, that's what intersectionality helps us grasp. It explains why Black and Hispanic transgender women face such alarmingly high HIV rates.
Yeah.
Their access to resources is just profoundly limited by this interwoven discrimination.
It's a lot to take in.
Yeah.
And sometimes to really feel the weight of it, a personal story helps bring these systemic issues down to earth.
Let's talk about Maria. You mentioned her, a Black transgender woman in Atlanta.
Yeah, Maria's story is, well, it's heartbreaking, but it really illustrates these interconnected challenges perfectly. She was kicked out around 17 just for being trans.
17. Faced immediate homelessness, no support network, few avenues for stable work. So, like many others in that position, she turned to sex work to survive.
Right, the survival strategy we discussed.
Exactly. And crucially, she had no access to health care at that time. No information, no knowledge about pre-PP. And tragically, she contracted HIV from a client.
It just shows how lack of housing, lack of economic opportunity, lack of health education, it creates this direct path to vulnerability.
It really does. It's like a funnel.
And Maria's story, as devastating as it is, it's not unique, is it? It feels like a really personal reflection of these huge systemic failures we've been talking about.
It is, sadly. And her struggle didn't stop with the diagnosis. When she finally did manage to seek treatment, she encountered a provider who repeatedly misgendered her, used dismissive language, didn't take her concerns seriously, and this, unfortunately, significantly delayed her getting onto vital antiretroviral therapy.
So the discrimination continued within the healthcare system.
Deeply. It just underscores how transphobia is embedded in some parts of the system and how it directly impedes treatment, creates more health problems, can even contribute to further transmission if someone isn't virally suppressed.
It shows the urgent need for systemic change in how care is delivered. It's not just about having the medicine available.
Exactly. It's about respectful, affirming care.
But Maria's story also has another side, right? Resilience.
Absolutely. It also speaks to incredible resilience, and it shows the huge potential for positive outcomes when resources are actually accessible and inclusive.
So what happened?
Well, she advocated for herself. She persisted, even after that awful experience, and eventually she connected with a community health organization, one that did provide gender-affirming care and the HIV treatment she needed.
And that made the difference.
It made all the difference. It shows that when those systemic barriers are removed, or at least lowered, people can thrive. Stories like Maria's, they really hammer home that awareness, education, and crucially action are vital. They save lives. They can reduce these terrible HIV rates.
Okay, so let's try and pull this all together. What's the core takeaway from our deep dive today?
I think the fundamental point is this: the disproportionate HIV rates among transgender individuals. They reflect a public health crisis, yes, but one that's rooted fundamentally in systemic inequities, not individual choices.
Right.
It's the pervasive stigma, the entrenched discrimination, the profound lack of access to appropriate, affirming healthcare. These create the huge barriers that increase vulnerability. They hinder prevention. They hinder treatment.
And just to reinforce that point, the way economic instability, transphobia, and structural racism intersect, that makes it even worse, right? Especially for trans women of color.
Absolutely. It creates an even heavier burden for them, these compounded disadvantages. But by really understanding these complex challenges, the mechanisms, the personal impact, like Maria's story shows, the systemic roots, you, the listener, you're better equipped to advocate for solutions that actually address the unique needs of transgender communities.
Yeah.
From Maria's story to the shocking statistics we started with, it's just so clear this demands immediate, informed attention and thoughtful action to ensure equitable health outcomes for everyone.
So the final thought for you listening.
Yeah.
What does this all mean for you? We've unpacked these deep-rooted systemic barriers today. What steps do you think we can take as individuals, as a society? How do we start dismantling these disparities and work towards equitable health for all?
It's a big question.
It is. And if you're keen to keep digging into topics like this, keep getting insightful information, make sure you visit Mind Expansion Daily. It's a really fantastic resource for more deep dives like this one, and also quick knowledge boosts. Helps you stay well-informed on critical issues.
Definitely worth checking out. And just remember, in this world where we're flooded with information, it's so important to keep thinking critically, keep seeking out multiple perspectives, nuanced perspectives, especially when we engage with complex societal challenges like this one. Your understanding, your engagement, That's really the first step towards meaningful change.
Couldn't agree more. Thank you for joining us on this deep dive.